Welcome to Healthy Habits. In today's video, we will be talking all about diabetes. The number of people with diabetes is higher than it has ever been. We would like to inform you about the early signs and symptoms you must not ignore. First, we will be talking about different types of diabetes. If you have type 1 diabetes, your pancreas makes little to no amounts of insulin. Insulin helps blood sugar enter the cells in your body for use as energy. Without insulin, your body will break down its own fat and muscle. Type 2 diabetes occurs when the body doesn't produce enough insulin to function properly, or the body doesn't react to insulin. This means glucose stays in the blood and isn't used as fuel for energy. In diabetes type 2, the pancreas makes less insulin than used to, and your body becomes resistant. Type 2 diabetes is more common. It is often associated with obesity and tends to be diagnosed in older people. Due to increased obesity rates, type 2 diabetes is seen in all age groups. In today's video, we will be listing diabetes signs and symptoms to be aware of. If a lot of these symptoms relate to you, please see your doctor about getting your blood sugar tested. The first symptom is frequent urination. Frequent urination is a common diabetes symptom, as we are aware. Diabetes is a condition that causes your body to have trouble creating or using insulin. Insulin is a hormone that draws glucose, or sugar, into the cells to use as energy. If there is not enough insulin or it does not work efficiently, blood sugar builds up. Too much sugar in your blood is taxing on the kidneys, which work to reabsorb sugar into the bloodstream. When the kidneys can't reabsorb the sugars correctly, urination helps eliminate the glucose from the body. Early on, you may not notice that you're urinating more often. However, a key warning sign is if constant urination starts to wake you up from sleep and depletes your energy levels. The next symptom is constant feelings of dehydration. This is related to frequent urination. There is a use up of water in the body. Water is pulled from your tissues to help get rid of the extra sugar because you're losing a lot of water. You can feel very thirsty. Your brain tells you to drink more water to hydrate. In turn, this triggers more urination. The diabetes urine and thirst cycle will continue if your blood sugar levels are left imbalanced. The next symptom is increased hunger. This is known as polyphagia. Hunger and cravings are a frustrating side effect of high blood sugar levels, even after you eat. You may still feel very hungry. That's because your muscles aren't getting the energy they need from the food you eat. Your body's insulin resistance keeps glucose from entering the muscle and providing energy. Therefore, the muscles and other tissues send a hunger message, trying to get more energy into the body. This leads to our next symptom, fatigue. Fatigue and weakness may occur when the cells do not get enough glucose. When there is not enough insulin, or the insulin isn't working effectively, it means the sugar in our blood cannot get into our cells. Therefore, our cells do not receive the energy needed. If you feel tired during the day, despite having slept well, this could be an early symptom. The next symptom is blurry vision. In a person with diabetes, fluid moves in and out of the eyes due to high blood sugar levels. This can cause the lens of the eye to swell. Blurriness occurs because the lens is the part that focuses light onto the back of the eye. This is a short-term issue that tends to resolve when blood sugar levels fall. The next symptom is increased amount of illnesses. The effects of diabetes make it harder for your body to fight off infections. Research shows that people with diabetes have more frequent illnesses, like flu, pneumonia, and skin infections. Extra sugars in the blood break down into a compound called dicarbonyl, weakening your body's defenses. Also, bacteria flourishes when there are high levels of glucose in the blood, making it even harder for a weakened immune system to fight off the invading bacteria. The next symptom is slower healing of wounds. When blood is thick with high blood sugar, it takes longer for white blood cells to get to the wound site and fight off infection, delaying the healing process. Diabetes may also affect circulation, causing blood to move more slowly. which makes it more difficult for the body to deliver nutrients to wounds. This causes the injuries to heal slowly, or may not heal at all. The next symptom is weight loss. You may be eating more but still losing weight, since your body isn't getting energy from food. It turns to muscles and fat. It starts to break them down in order to create energy. This causes a reduction in body weight. The next symptom is patches in skin. A common symptom of diabetes is a condition called acanthosis nigricans. Some of your skin may turn brown or black. It usually shows up in the armpits and neck. It can be a result of the insulin resistance associated with diabetes. Finally, having numb or tingling hands or feet is a symptom of diabetes. High blood glucose levels can damage the small blood vessels that supply the nerves in your body. This stops essential nutrients reaching the nerves. As a result, the nerve fibers can become damaged, and they may disappear. Overall, diabetes is becoming more and more common in today's society. A healthy diet, regular physical activity, and maintaining a normal body weight are ways to prevent or delay the onset of diabetes. Over time, diabetes can damage blood vessels in the heart, eyes, kidneys, and nerves. This is why it's important to spot early signs and symptoms. If many of these symptoms relate to you, take a blood glucose test to help diagnose and monitor diabetes. Thanks for watching. Make sure to like, share, and subscribe for more healthy habits content.